Welcome back to another episode of Ballroom Chat, the podcast dedicated to sharing the dance journey. I'm your host, Samantha with Love.Live.Dance. We are kicking things off with a little bit of injury prevention and recovery talk, which is super, super important for all of my lovely dancers at whatever level you are currently dancing at. I had the amazing opportunity to talk with Alisa Pravdo. She is an assistant professor at the University of Maryland School of Medicine in physical therapy and rehabilitation science. She also is a Board Certified Orthopedics Specialist, and she is a Fellow of Orthopedics in manual physical therapy. She also, very importantly, has a Bachelor's of Arts degree in dance from Goucher College, and she was a dancer for many, many years before becoming a physical therapist. So we talked today about what actually brought her into physical therapy from her history of dance, how she works with clients that are either dancers or in other athletic pursuits, and we answer a bunch of your questions and talk about some of your experiences and get her opinion on what we can be doing better to prevent injuries from starting, protecting ourselves once injuries have happened, and how we can recover faster once those injuries do occur. So a lot of great information from Alisa today. I hope you enjoy our conversation. Well, thank you so much, Alisa, for being a guest on today's podcast.
Thank you for having me.
So I mentioned in the introduction that we are super excited to chat with you today because of all of the injury prevention and sports medicine that you have in your background. But you are also a former dancer, which is super exciting. So let's kind of kick things off by telling the audience a little bit about your dance background and how it led you into physical therapy and orthopedics.
Awesome. So I've danced my entire life. I think I was 2.5 at my first dance recital. And that was my major in college as well, along with psychology. So I went to Goucher College and graduated with a Bachelor of Arts in Dance in 2008. And that's really when I was thinking about getting into physical therapy and working with dancers. And I reached out to do a clinical rotation or just some shadow hours with the physical therapist that was treating the dance department. So that's when I got my feet wet with that. My background, I came from one of those studios in the suburbs of Philadelphia that it's like a competition studio. So grew up doing ballet, modern, jazz, tap. Lyrical was always my favorite. I think I knew personally at a young age, I probably wouldn't be a ballerina, just based on my anatomy and my natural turnout. However, I am ballet trained and I love it. I would say lyrical and modern was like my love and passion and my area to shine. So then after college, after graduating Goucher in 2008, I went to PT school at University of Pittsburgh and got my DPT there. And I graduated there in 2012. And I did get to do a little bit of an internship too with the Pittsburgh Ballet Theater. So I got to work backstage with the Nutcracker and get my feet wet with working with dancers too, which is, I'm sure we'll get into that today, definitely different than treating just the everyday orthopedic population, which I also love to do. So I guess for me, it's funny. I think when people were talking about going to PT school, people think, do I want to be a physician or do I want to be a PT? I never said that. I was like, do I want to go to New York and try to make it as a dancer? Maybe work as a waitress, maybe get a job. Or do I want to go to PT school? And I ultimately went with PT school, just I think being someone who likes to have a plan and know my next step. But it makes sense. I feel like my love and passion for the way that the body moves and for the way it works and for anatomy brought me into the world of physical therapy. Even going back when I was at Goucher, I did an internship at Shepherd Pratt, thinking I wanted to do dance psychology. So working more with dancer, it was really on a floor of women that had eating disorders, and it was almost where you didn't want them to move a lot because you didn't want them to burn too many calories. And even though I found that interesting, I learned that that wasn't what I wanted to do every day. I wanted to do more with movement. I wanted to be more active. So that's kind of what led me into PT. That was a long answer.
But no, that's awesome. That's awesome.
Okay.
I think it's super interesting that you mentioned that you spent a little bit of your time in college kind of working behind the scenes with the Nutcracker and like getting that hands-on experience. How much of your own personal dance experience has influenced the way that you approach your practice of physical therapy? Like, do you see the body in a different way than maybe your coworkers or the students that you're working with now with University of Maryland?
Yeah, I think, that's just always where my basis will be because that was my whole life. And I think, as you guys know, as dancers, like it's a way of living. It was my like what I did every night and weekend. It's the way you move and looking at somebody walk and looking at somebody's turnout. It's something we try to teach our students all the time is watch your patient do the thing they're having trouble with. We can have you lay down on a mat table and do clamshells all day, but I don't watch that person run. I don't watch that person leap. I don't watch them golf and look at their golf swing. Then I'm going to miss where the breakdown is. And I think that's where people that come to PT for years and years and years, and maybe we're not hitting that, that's what we're missing. So we're trying to create PTs that will be better than that, and that will really capture what's going on with somebody functionally and make changes in real time. So I think I can tell when somebody walks in the room as a dancer. Like I remember my mom saying that to my dance mom friends, like friends of the parents when we were growing up, is you can just watch them. Like that they're dancers by the way they hold themselves, the way they walk in. And I think there's just a way that we move as dancers that stands out to me. So yeah, I think there's something I'm looking for. And if I'm treating somebody who's not a dancer, which I do very regularly, most of the time, I might have to watch a video on their sport and watch what they do to kind of get myself up to what they need to do functionally in the way they move. So I think there's people think, oh, you can straighten somebody's leg a certain degree that their hamstrings are flexible. But as a dancer, we need more than that average of 70 degrees of a straight leg raise. Dancers want to kick their legs up here. So that's not the normal for that person. And I think as a dancer, having somebody treat you that knows that background is really helpful because they know what's important to that person and not just like what a normal is.
For sure, for sure. Well, and I like the fact that you just said, if you're working with someone that maybe is in a different sport that you're not as familiar with, you go and watch the footage and try and learn what it is that their sport requires or what their job requires so that you can attack, what their needs are because it might be different than, a 60-year-old or a 70-year-old or an 80-year-old that is at a fall risk, which is where,
Absolutely.
my mind tends to go first with physical therapy. And then, oh, right. And also the sports medicine thing that's like a huge component of the industry.
Yeah. It's amazing how much falls into the PT umbrella, which is really the fun part of my job. Um, I thought maybe all I wanted to do was work with dancers and go like right into, I would love to be a PT that works with a Broadway show. But I really do like seeing the mix of everybody. And in my clinic, I treat as probably as young as 6-year-olds and up to people that are 100 if they're here that long. And yeah, needs of everybody are so different. And I mean, one of the first things that we should be doing as PTs is asking you as a person, what are your goals of being here? What do you want to achieve? What's important to you? Because yeah, sometimes it's just being able to walk in the grocery store versus, hey, I want to do a 2-hour ballet or a ballroom competition.
Yeah.
So as you can see, I know less about ballroom dancing specifically than ballet, modern, tap, jazz, but I think there's a lot of things that I would ask the same questions. What are your shoe wear? What's your rehearsal schedule? What's required of you? So all that still falls into it.
For sure, for sure. Well, and kind of going along with your list of questions, how much does the equipment that we use, right, the shoes, the clothing, the attire, affect the movement itself and both injury prevention and the likelihood of injury in the first place?
So there's definitely something to that. There is specificity of training. So, a baseball player needs a ton, if you can see my shoulder, needs a ton of external rotation to have that power behind them and less internal rotation where their power is. So it's not a bad thing if that's what that athlete needs for their sport. So same thing with dancers, especially ballerinas, you want to be in that turned out position so much that our hips get really, really externally rotated. And maybe we lose some of that ability to internally rotate. Shoes, I mean, shoes, whether I'm working with runners or dancers, I like that person or their cleats, if they're a soccer player, I like them to bring in the shoe that's required of them because that's what you're using. I'm assuming you're probably in high heels most of the time when you're dancing.
I've got examples that I'll pull out here momentarily
Okay.
to talk through because I've got a bunch of questions for you when it comes
Great.
to what we're wearing and should we be wearing
Perfect.
them. But yes.
So I think shoes are certainly going to play a big role, especially when people are on point, but even modern dance and bare feet. And we'll talk about high heels. And there's character shoes that I had to wear too. So I was in heels temporarily too. So I think that will play a big role in a lot of things, injury for sure. Outfits less, but probably depends on if you're wearing a heavy thing or a corset that would constrict your breathing. So I think it depends on the costume. If I'm thinking of a really light costume that is spandexy and easy to move in, not so much. But heavier skirts or like heavier gowns, that could play a role, especially if you're not used to dancing in that. Like, how often do you practice in that? Is it just like a week of dress rehearsals, or is this something you were practicing in for months leading up to your performance? So I'm sure we'll get more detailed into that.
Yeah, yeah. So maybe let's start with the feet and work up the body because
Okay, works
that's
for
where I
me.
tend to think of as a dancer. It's like feet up, center out, which I know
Yeah,
is in conflict with itself, but that's
I'm
kind of
okay
how I
with
think
it.
about
We
things.
teach feet up in DPT curriculum as well, Doctor of Physical Therapy school. So I'm okay with that.
Awesome. So, obviously, in ballroom dance, we have different footwear depending on if you are a lead or a follow, if you are dancing specific dance styles, if you're dancing more socially versus competitively. And the theory is that the footwear is both functionally appropriate and aesthetically pleasing. Those might or may not come into conflict with each other occasionally, but the most comfortable pair of shoes that I have in my current repertoire, and I will say for the podcast listeners, I am not endorsing any of the brands that I currently have. These are just what I currently have in my closet. Some I'm still competing in, some I'm not. I'm not going to get into the whys or hows or whats, but typical example of a teaching practice shoe or a ladies practice shoe has what we refer to as a Cuban heel. So it's a wide base. It is a split sole, so we don't have a shank running through the middle of the arch. This is a Cuban heel, so it's a 1.5-inch heel. It's similar to what the gentlemen will wear competitively for Latin. So the guys will actually wear a Cuban heel as well. And then this is a closed-toed shoe. You can find them in the West Coast community that have an open toe shoe similar to a sandal. So this
Okay.
is like my foot saver. This is the most comfortable shoe that I have, and it's got a 1.5-inch heel to it. So right off the bat, what are your kind of take as far as like living in something 20 to 30 hours that is that heel height and that construction?
So the first thing I think when someone is on a heel like that all day would be I'm wondering about like what happens to your Achilles and your gastroc length, so your calf musculature. So I'm assuming they're probably pretty strong because you're on point, just like a ballerina would be on a point shoe. But at the same time, is there shortening that occurs in that muscle as well because it's in a position of being shortened? It's already in that almost contracted position. So one thing I would want to know is so many of us can get through running, dancing, jumping without actually having very strong calves. So one of the things I always look with my dancers is how many single limb heel raises you can do on both sides. So just generally speaking, you should be able to do 25 single heel raises where you just go up onto your toe um, bilaterally without any discomfort to say you have a 5 out of 5 strength. A lot of people get around that without actually having that strength. The other thing I think when I look at a shoe and I'm looking at a runner is how flexible is their foot. Probably as dancers, we tend to run on a little bit of a hypermobile side, on the more flexible side. So depending on that person's foot, I would want to look at them stand with and without a shoe on. I want to watch them walk. If that foot is very, very flexible, looking at that shoe is also very, very flexible in the forefoot. So it would make me think there's not a lot of support there for that person. However, somebody with a really, really strong foot who's maybe been pointing their foot since they were 2, or 11, or however they were when they started dancing, might be strong enough to be in that position. I know I have a lot of friends that like to lift weights with being in bare feet and dance all the time in bare feet. And if your foot is strong enough to support that, I think that shoe would be fine for that reason. So I really, everyone's foot is different. So I don't think that there's a one right shoe for everybody. Looking at that, it would make me ask you, how do you feel in that shoe? You said you're most comfortable in that shoe. Are you comfortable, or is it comfortable compared to the other ones?
It's
Are there even ballroom shoes that have hard,
yeah,
soles, like a shank, like a point shoe?
yeah. I would say it is the most comfortable shoe if I'm wearing a non-sneaker shoe, right? Um, do my feet hurt at the end of like a 12-hour teaching day? Absolutely. Absolutely, without a doubt. Um, do they hurt less than if I was wearing some of the other shoes I'm about to show you? Yeah. Yeah, it's noticeable. But if I was going purely for comfort and I'm going to teach for 10, 12 hours, I've got a 30-hour week ahead of me or a 40-hour week ahead of me. I just need to survive this week, and I'm not worried about being able to properly demonstrate at the highest ability to my students what I'm asking them of. I just need to be able to stand and watch them. I'm going to wear a pair of sneakers every single day. I'm not going to wear those.
Okay. And are
But
you pointing in your shoes?
I am absolutely pointing in my shoes. I'm not going on point.
Okay.
Right.
Gotcha.
Yep.
Yeah, I would really want to look at that dancer's foot. So I have a lot of feelings when I look at that. I also think you guys are amazing for being, it's been a lot of years since I've been in a point shoe for that many hours in a day. Um, but I remember it being hard. And we're also not on point the whole time you're on a point shoe, but up and down and up and down and up and down quite a bit.
Yeah, yeah, for sure. And if you think about, well, we'll circle back to it because that's one of the big things that I wanted to get into today.
Okay.
But yeah, so the Cuban heel or the teacher practice shoe, that is what our gentlemen are competing in Latin, and that's the appropriate teaching shoe should you wish to not be in your full heels. When we get into ballroom, which is standard, and American smooth, we then have something more akin to a lady's pump. So I've just got 2 examples. One is more of the standard shoe variety. So this does have a metal shank going through, so I can't bend this shoe in half. This one I think is a 2-inch heel, and it goes straight to a point. So it's more of the straight heel size. It has a little bit of flexibility where I can go up on the ball of my foot, but I don't have the ability to fully point that toe should I want to. And then this is more of the smooth style variety. It has a little bit of the support, but it ends, so I can actually go ahead and point that toe and flex it fully. But the arch is a little bit more supported. This is a 2.5-inch heel, and it goes to a flare on the base, so it's a little bit wider at the bottom. But this is both of those are closed-toed once again, so the ball of the foot is covered by material.
See that? Okay. Well, that definitely shows too that with your Cuban heel, with that wider base of support, that's definitely going to be more comfortable for 12-hour days versus a much more narrow heel, which I know you guys have to wear as well. But I wouldn't be surprised if there's foot, calf, hip, and back discomfort with wearing that all day.
For sure, for sure. And just a little bit kind of giving you the context for how we use those shoes.
Yes.
We do have a full contact with the ground as we're taking forward and backwards walking steps.
Okay.
So we're pushing off of our standing leg in order to create movement. But if we are doing a forward action and we are lowered, so we're in a softened knee, we are hitting the heel and then rolling either to a flat foot or all the way up to the ball of the foot in that shoe. Same thing going backwards. We would be pointing the toe, softening onto the ball of the
And
foot, and then going all the way back to the heel.
okay. And you're not doing, well, do you do large leaps off the ground?
The only time that we have a leap would be in quick step, which you would have like a figure 4, or you would have a rocket where you do that kind of spread, but you're in closed connection with your partner. So
Okay.
you would have either hip to rib connection with your partner or just rib connection with your partner. So we aren't going to have like the full leap that you would see a ballerina do.
That makes sense. And that can also help descend and control that person's landing. So it's not like all coming down on the shoe if you're connected in some way.
Yeah.
So that makes sense.
Yeah. So that's kind of our ballroom shoe. That, like I said, is more of a traditional walking method, exaggerated. But you are putting pressure through the heel all the way through the ball and still rising up to the ball of your foot and then lowering down to a flat. The last shoe that I have is more of a rhythm or a Latin. So this is, once again, this for me is a 2.5-inch heel because I'm 5'10" and I don't need to be on a 3.5-inch heel, but they do sell and dancers do dance on up to a 3.5-inch heel. I have a flare, once again, so it's a little bit wider, but I have seen competitors dance on a straight or even a stiletto style heel. This does, once again, have a little bit of arch support, but the ball of the foot has the ability to bend and flex. And then you are on more of a sandal. So it's connected pinky to big toe, kind of in that large knuckle. We do have dancers that will trim the toe block off so they can actually have the pads of their toes on the ground while they're dancing.
Okay.
And typically in Latin and rhythm dancing, the weight is supposed to be held more on the front of the foot. So we talk about getting the rib cage and the spine over the ball of your foot, over the front of your foot. We use the heel more as like a grounding at the finish of the movement to like settle the hip or roll through the hip, but you're mostly dancing on the front of your foot when you're doing Latin or rhythm dancing.
Okay. That makes sense with those shoes. Do people have the opportunity to put other things on the bottom of their shoe if they needed some extra arch support or something under a toe? Could they get that in there without it being seen?
Without it being seen, no. Do dancers do it? Absolutely. You see folks that have like arch support that they add into their shoe, or if some of our older dancers, even some of our younger dancers, have bunions or other things, they can put pads or cushions in to kind of customize their shoe to be a little bit more comfortable. But it's visible. People notice if that's the case.
Sure.
Yeah. So let's talk about like the least common denominator. Healthy person in their 20s to 30s, relatively athletic, fairly mobile, no other history that would put them at a higher than likelihood risk of injury. Simply by taking a look at the footwear that we are wearing. Is there something that you would recommend, if we can't change the footwear, that we can do on our own to make sure that we are not putting ourselves at a higher likelihood just based on what we've got on our feet?
Yes. So before I even answer that, I want, is there like very common issues that as a ballroom dance community that you see more than others? So are you seeing a lot of Jones fractures or issues with the fifth metatarsal? Are you seeing like a hallux valgus and bunions, like anything that sticks out to you? And then I can target that answer a little bit.
Yeah. So when I asked my Instagram followers what they would like to talk about or what their history with injury has been, I specifically limited it to feet and knees for the purpose of this conversation, because I know backs, shoulders, hips, like The answer is yes. If the
Yeah.
question is what is a problem for dancers as far as injury goes, yes is the answer.
Yeah.
But the ones that came out were fifth metatarsal break, mainly from improperly rising and having a little bit of ankle weakness and rolling onto that pinky toe when they shouldn't have.
Hmm.
Bone spurs, scarring of the joint, scar tissue in joints in their feet. A lot of dancing on fractures without realizing they were dancing on fractures. Yeah, I think those are the main ones when we're talking specifically about foot injuries.
And that makes sense and very, comparable to a ballet population. I just remember when I started working with dancers, seeing the scar on the bottom of everybody's great toe. And I was like, what is that? And so many dancers had an FHL or flexor hallucis longus release, which is like the muscle that helps you point or flex your great toe. So in a point shoe, I think I'm going to see that more than in your shoe. However, I'm not surprised. That was my first guess with the fifth metatarsal, just with the shape of that shoe and not having a lot of support. I could certainly see people rolling to the outside of the foot, whether it's a traumatic, not supposed to happen thing or repetitive micro trauma over many, many, many hours of practicing that then leads to a stress fracture that people don't realize they have for a long time. If you ever have that point tenderness in one spot, that's a sign to kind of ask yourself, could this be a stress fracture? Where if it kind of radiates along the whole side of the foot or it wraps around here, that's not always as likely to lead me down that pathway, but like it hurts right in the spot. It hurts when I touch this spot. Ask yourself if it's something you need to get looked at. Of course, your dance shoes are not ideal, but that's not our option, right? So if we are dancing in a heel, we are dancing in our heel. If you're somebody that has issues with balance, then you're going to be someone better with that Cuban heel or the wider. However, your scenario of our healthy 20 to 30 year olds, no reason that they shouldn't be able to dance in a heel. The biggest thing is keeping your foot and calves strong. So we say in clinic, kill the calves. So we want to kill, like work your calf musculature to the point of failure, like to the point that like that's all I can do right now. So all the heel raises you can do, releves. So just with your knees straight, with your knees bent, holding it. So coming up onto your tippy toes, holding it with your knees straight for 60 seconds. Doing it again with your knees slightly bent. Hold that for 60 seconds. So hitting all different areas of your gastroc and your soleus. Um, Another thing I'm a big fan of working with dancers, but anybody who has weakness in their foot, really, I want to say look at the strength of your posterior tibialis, which is a muscle that lets you point and invert. So it's kind of like a J motion. Um, we will work on doming because that muscle comes down and connects to the navicular in the foot. And it's one of the muscles that almost helps to hold up the arch of the foot. So look at your foot positioning. If it's flat, if you don't have an high arch, I strongly encourage that you start working on something we call doming. You can certainly look that up on the internet. It is there, but it's not a scrunch of your toes. I don't want you working all the flexors of your toes. You're trying to keep your toes straight and lift the arch of your foot. So my hand is mimicking my foot. It's really quite difficult, but that will be working the muscles that help to support holding your arch up. There's been studies done on this. Patients and people really do better after strengthening that muscle. It doesn't mean if you have a flat foot, all of a sudden you're going to have an arch. It doesn't change it's your anatomy, and that's okay. But what you can do is strengthen the muscles to support your foot. So same idea. If someone starts doing really well with that, maybe I tape the arch of their foot up, or maybe I put something in their shoe to give them some arch support. Yes, I don't do that all the time. And yes, that can help. Yes, you might want to do that in your high heel, but it's not something you have to do if you really start working the active muscles in doing that. Um, so that might help you with rolling in and rolling out and causing some of the stress fractures. I don't know if your dancers have, so with the ballerina, when they start, getting into competition and start getting into a point shoe, good dance teachers should, and mine did take us to the store to help us get fitted for the right point shoe for us. So there's block points, which point shoes, which are really, really a wide base of support. And then there's all different brands. And really what I learned is you want a shoe that mimics your foot. So I thought I have a narrow base, I have a narrow foot. So I wanted a block. I wanted this wide base to make up for it. But I quickly learned I actually wanted a shoe that mimics the shape of my foot to help me distribute my weight on point. So even though there's different styles, can you pick variations of that style when you go to buy your dance shoes?
Um, yes and no.
Okay.
So
Yeah.
what I would say is there are many different iterations of the same style of shoe. So, if I pull the Latin shoe back out. So, things that you can customize, I've found a round shoe. Some sellers have more of a square base, so you can choose what kind of toe base you want. This is more of a braided. You'll have some that are more like strapped. Some might have like a mesh in between the straps. Some will have more straps than others. This is kind of a crisscrossy at the ankle. Sometimes you'll see more of like a T shape, or it'll just be a singular ankle strap. So there's a little bit of customization there. What I would say though, this is just my experience, having the shoe manufacturer or shoe retailer in the space with you, fitting it to your foot, is something that you really only come across at competitions where you've already bought your shoes and you're buying new
Sure.
shoes. Or if you are at a studio that specifically brings in someone to do a trunk show, which
Mhm.
you have to have a certain amount of clientele base before someone's going to come into your shop or into your studio. So a lot of times, either you're buying blindly online, which can have mixed results. You're waiting for that competition to go and actually sit down with someone and have them fit your foot, which they may or may not have the right shoe in stock at that competition. Or you are in a situation where you're at a studio and that studio owner has partnered with one of the brands and has an amount of stock in that you can put on your foot. I would say most people are probably buying online or buying from their studio. And if they're buying from the studio, it's, does this shoe fit? Okay, great, buy it. Not
Gotcha.
necessarily having that conversation of what is the benefit of having a tight heel cup or a wider toe base or a tight toe base or more arch support or less arch support for you, the student, because quite honestly, we're not trained in that as teachers.
Sure. Yes. Yes. I understand that. I remember going back to take one of the first continuing ed courses that I took as after I graduated as a PT, and it was on fitting dance shoes. And I literally danced for over 20 years of my life and I'm just learning what the right dance shoe is. Like that's crazy. So okay, in an ideal world, then yes, it's finding someone to fit your foot and talk through the materials and the width of your heel and all of those things with you. My advice for those of you that that's not an option at the moment, is to try to find a shoe that mimics your foot. So if you have that broader, metatarsals where kind of the knuckles of your toes are, if that's a wider foot for you, then I would recommend one that is wider. And if you have a narrow foot, don't think that wider is better. So you actually want it to fit your foot because that's going to help you better distribute the load of the force going through the foot. The reason I even started thinking about that is because of bunions. So the reason a lot of bunions occur is Wolff's law. If you go back to science from being younger, is if there's force applied to it, it's going to build up force to fight it and grow bone so that it doesn't get irritated and uncomfortable. So if you're someone who really likes to wear pointy shoes and all of a sudden you realize that like the side of your great toe is starting to stick out, make sure that you're also wearing shoes that don't just rub that spot because your body is doing its natural response of trying to fight that and protect yourself. Sometimes that's our anatomy and maybe that's passed down from our grandparents and parents, and there's nothing in your control if you have a bunion. We call that hallux valgus. So it's when that great toe, the side of it, it looks like a big ball, and then the toe kind of points that way. It's a tough surgery to go through and heal from, even though it's something that is done a lot. So um, my suggestion to you, if you're someone who has that, is really look at the material that goes over your toe. So you have that braided one. Is that comfortable? Is that soft? Is that better for you? Versus like a harder piece of plastic there, I would not pick for somebody who's having issues with that great toe or starting to get a bunion there. Um, you might also get them on I get them on the pinky toes of my feet. So it kind of depending on where you distribute your load and that foot posture can really influence where you rub. So look at your foot, pair up, even something you guys can do in dance class, but pair up and look at each other and say like, okay, you have a flat arch, or you need something that has a little bit of a harder shank versus like your foot is really strong. You can have something that you can bend and it's flexible. And okay, your toe goes in that way. Make sure you get a material that's going to be a little softer going over the base of your toes versus something that can be a little bit different. I mean, even like if you can get a cut, like something that has cutouts, like that might be really good for your foot if there's rubbing in that spot to have something that's open there versus somebody who wants that closed and protected. But if it's truly a bunion or it's totally this growth of bone because something is rubbing there, really look at your shoes and see if something is rubbing there and what can you do to take away that extra pressure.
Yeah, and I imagine that goes for both in the activity that you're doing and also outside of that. So I know for
Absolutely.
me, like I very rarely wear heels now outside of when I'm dancing because I know I'm putting my foot through the stress on the dance floor. I don't want to like
Yeah.
double it then when I'm going out for date night. I'll wear something more comfortable to give my feet kind of a breather to let them relax and chill out for a couple of hours.
Yes, and that's really good that you know that. So, realize, okay, if I'm going to be in dance practice or in dance class for 10 hours, like, what do I need to do when I'm not here? Like, do I need to completely go opposite into a different shoe? Do I need to be barefoot? Do I need a supportive sneaker for a day to give the muscles in my foot a little bit of a break?
Yeah,
So it's
for
good that
sure.
you do that.
Kind of going along with that, we had a question from one of our followers about suggested exercise to minimize heel pain after practice. Now, I know for me personally, a lot of my pain is more on the ball of my foot, big toe, joint area. But for
Okay.
someone who is experiencing it more heel, Achilles area of their foot, what would you suggest someone do to minimize pain and also help with recovery after practice?
That's a great question. So when I first think heel pain, my first question for that person would say, do you have any history or current back issues? Because I want to make sure that it's not referred pain to the heel from an L5 disc or nerve. It doesn't mean it's something surgical or something that it could just be pressure on a nerve contributing and causing heel discomfort. So if it's not, if it's truly local to the heel, it's related to practice. That could be from an Achilles tendonitis. That could be something of a plantar fasciopathy type of issue. So different things that connect into your heel. So that could be your calf musculature, and that could be the plantar fascia on the bottom of the foot. So I do not recommend Googling what to do for plantar fasciitis and rub your foot on a ball and an ice bottle. That is not very rarely what I give to people, but that's what you'll see online. Um, if I'm going to give that to somebody, if you have a really, really high arch, so again, look at your foot position. If you have a naturally crazy high arch and it's stress and tight on that plantar fascia, one thing I would say try to do, hold your great toe and then just pull it back into extension and see if it's tight along the bottom of your foot. So that's just stretching the plantar fascia that goes along the arch of your foot. If that feels uncomfortable to you and you have that high arch, then I think rubbing it out, using a ball, using your own hand, that's fine. If you have a flat arch, chances are the plantar fascia is actually overstretched. So I don't want you to roll it out more. I don't want you to massage it because you're just feeding in and trying to overstretch something that's already overstretched. Um, that's the hard part of, like, all our bodies are different, and come see me because then I can give you, a detailed exam that's specific to your body. So take all these kind of general points and really look at yourself if you're listening to our podcast, and then really try to figure out the right thing for you. So a lot of times somebody's foot is more flat, and flexible, and then that's the person I want to strengthen. So for that person, I would say go back to that doming exercise we talked about. There's also something called toe yoga that kind of works you through, like, just lift your great toe, lift the other four toes and not your great toe, and then lift those four toes and just put your pinky toe down. I'm terrible at it. It's really, really hard, but different things you can try to do. If you Google toe yoga, you'll see it. But different foot intrinsic strengthening exercises. The other big thing I'm going to probably go back to several times today will be calf strengthening. So whether it's a tendinitis, which itis is inflammation. So if that's usually an acute thing, something that happened more recently, and it's inflamed. So that's different than what a lot of us have, where it's more of a tendinosis, where in the tendon it's almost degeneration and breakdown. So this is your runner, your dancer with Achilles pain for months. That's probably the majority of us have more of an osis than an itis. So for that person, I recommend heat over ice because I want to bring blood flow to the tendon. I want to bring the oxygen and the nutrients that helps you heal. With a true itis, you just sprained your ankle. It just happened that day, and you like to ice it. Sure, that first 24 to 48 hours, that's when something like ice will be more effective. I'll also say if you love ice or you love heat, this will always be a conversation with healthcare providers. Neither is going to hurt you. So I want you to do what helps your body. My bias, my training has really focused on the reasons that heat is a little more beneficial than ice. So I would personally recommend, if you only have time for one or right after exercise, I would say to put some heat. Um, but like I said, if your body loves ice, it's okay. Do what feels good to you. So with that osis, tendinosis, maybe that's causing the heel pain because it attaches into your calcaneus or your heel. For that person, I would heat it. I would do a lot of calf strengthening and doming exercises. Again, knee bent and knee straight. A lot of people do releves with their knees straight. Make sure you're also doing it with your knees bent and those isometric holds. Um, I am not a no pain, no gain person. I'm not somebody to usually tell somebody, like, push through it, it should hurt. But the research with tendinosis does show that you do push into that painful area, that it's all about load. So if you're someone that has heel pain or Achilles pain that's been there for several months to years, it's not an acute finding, it's something more chronic that's been going on. Maybe it comes and goes. I would say load is important. So you want to do a lot of repetitions in weight bearing, single limb, double limb. And it's okay to feed in, like, to go into that discomfort with a true tendinosis. It's the one thing one of the things that I would push somebody to go a little bit into the discomfort when they're doing it.
Awesome.
So that's my advice with
Excellent.
that.
Kind of along with that, the other, I'm going to kind of link to a question and a story that was shared with me. And the question is kind of moving up the chain. So talking about knee injury prevention, and talking about the calf. One of the wonderful followers of the podcast shared with me that they actually had a pretty nasty calf tear that essentially ended their ability to dance competitively, because they found themselves in a situation where the body moved, the foot didn't, and unfortunately something had to give. And we do see that a lot happening, more so in the knee. In my experience, I've heard of more stories happening with knee injuries resulting because the foot didn't move when the body did. But in this person's case, it was a calf tear that happened. So aside from the obvious of make sure that if you're rotating, your foot moves as well, what can we do to either strengthen different areas, or what can we do to just prevent that from happening if we're doing everything else correctly?
Yeah, that's a good question. And that risk is always there for any athlete. Um, the best we can do is proprioception, plyometrics. So Yes, like work your natural turnout. That's something we talk about in dance all the time. So it don't force it from your knees. So in training at in class before you actually go out to do routines on the floor, warming your body up, making sure that you are, doing something dynamic across the floor. So whether you're walking and kind of kicking, or walking and doing some butt kicks, or walking and doing some releves, but something where you are warming your body up and getting everything to communicate with each other. So your core, your hips, your knees, your feet, like everything should kind of be there so that hopefully in that second that something would happen where like my example, when I'm talking with patients is that second you almost roll your ankle. You step down that curb and you almost roll your ankle, but you catch yourself. That's what plyometrics is and proprioceptive exercises are to do. So when I say proprioceptive, that's your body's ability to pull in muscles and nerves and everything that kind of comes together to stabilize you. And it all happens that quick. But doing these exercises where you're working on a warm up, where you're working on turning out from your hips and not forcing the turn out from your knees, where you're pushing. And I know you probably don't have to be in a turned out position quite as much as a ballerina, but you're pirouetting, you're doing
Yeah,
spins and turns.
and there's still a lot of external and internal rotation in both standard and ballroom. And then when you get into Latin,
Yes.
we actually are supposed to have an amount of turnout, and coming from the hips and not from the ankle or the
Yes.
knees. That's a big challenge for a
It's
lot of folks.
big. It's big, and most of us do not have as much turnout as we would like, and we force it. So please, if you don't have as much turnout, it's okay. Use what you have so that you're not injured, because if you hurt yourself and then you can't dance at all, that's just not worth it. And I know that's easier said than done, and it's one of the reasons I'm a PT and not a dancer, is my turnout is my turnout, and it's not a ballerina's turnout. So what our natural anatomy, that's something that we don't have control over. But what we do is strengthening and working on neuromuscular reeducation and these types of exercises within our physiological limits and our natural ability to be the best we can be with what we have to hopefully prevent injury. um, so that can also just be like, for an example, people I feel like always know things like skater jumps or lunge jumps. So kind of getting where you have to soften your hips, your knees, and work into this rolling through your foot position as you land from a jump. I'm a big fan of just small jumps in place before going on stage. Again, just like working through your foot, softening your knees, softening your hips, engaging your core. Just the best you can get everything talking to each other. And we don't think about it, right? We just get up and do it. So taking that time to be like, am I warmed up? And can I work on these things? But going through just these drills in class and going through these moves and practicing your spins and practicing your pirouettes, it's never as fun as like doing your routine on the floor, but it's so important because that's what allows us to be successful on the floor. So, that moment might happen, but the more training you do behind that strengthening and the dynamic warm-ups will hopefully give you that foot up to prevent an injury from occurring in that moment.
Well, and I imagine, and I know we've kind of talked about this in previous episodes, that it's not just the warm up, it's also the cool down. And it's making sure that
Yeah.
we're getting our body ready to do all of the things that we're going to ask for it. And then also telling it, okay, it's time to soften and get ready to go back into the car for 45 minutes for the commute home.
So true. Yes. And I think it's pretty well known today that like your warm up should be dynamic versus static. So we don't want you just like sitting in a straddle for a warm up. Um, but like I mentioned, like a butt kick or even doing like grand bamas or just kicking your leg, but doing something dynamic across the floor or at the bar. I know like a lot of dancers do like the leg in and out, kind of just to warm things up and work on rotation, but doing things through movement and start small and build up high before going into your workout. And then after, you can start going into a little bit more static positions and really breathing through it. But absolutely, you don't want, your blood to pool in an area. That can cause what my friend loves to say DOMS. So delayed onset muscle soreness. So you feel really good in that moment, you stop, you go home, and then the next 2 days you're like, what did I do? So just that cool down is going to help prevent that because it moves the metabolites in your system. It prevents a buildup in your calf or in your hip where you're going to feel sore and achy the next day.
For sure, for sure. There is so much more that I want to get into, but I
Yes,
know that
yes.
we're pushing on time.
You're okay.
I want to talk first about when and how to seek out a physical therapist and a good physical therapist to work with dancers, because I feel like so often, and I know I am guilty of this, I know I have colleagues that are guilty of this, the acceptance of pain as a reality of our industry prevents us from seeking out help early enough to prevent something. And it's almost always well, now you've been dancing on a fractured foot for 7 years. The only option is surgery. And we know that you don't want to do surgery because that's going to end your career. So when should we start seeking out help from medical professionals? How soon should we start? Should we wait for our bodies to give us pain signals before we reach out, or should we already be working with someone to prevent injury from day one?
If it was up to me in a perfect world, I feel like it would be so great to have PT almost like you would see a primary care provider. So doing these check-ins to just doesn't mean you have to come see me 3 days a week, but to come in and tell me what you're feeling, what's demanded on your body, what are you having difficult with, for me to watch you do what you do to give you the strengthening exercises to help prevent injury. I would love if I could see all athletes, including dancing athletes, um, pre-injury. That is not always this option in our insurance world right now. But that's what I would love, and just to have these like check-ins where we could go through and do that. I have this young dancer right now who is doing great and healed from an ankle fracture. And her mom is telling all of her friends, and I love it, that like they're watching her dance and she's going across the floor, and like she's learning all these things because I see her knees come into a valgus position every time she plays, and I see her foot roll in. I can just see future injuries that are possible, even though she healed from her fracture and has no pain right now. She's 12 years old. Like, she's a long history that I could teach her things, and am teaching her things that will hopefully prevent her needing to come back for an injury. So it's great because now I'm starting to see some of her friends come in too. So that would be ideal. I mean, the second you start having pain or something unusual, and I'm like this too, I don't go to a doctor unless I really, really, really need to. So I understand. And if you told me not to dance, I probably wouldn't listen. So one thing I always tell my students and to tell our patients, like, you have to give them a win. So, okay, if this hurts, maybe I need to take them out of jumps right now, but can they still do bar, or can they still go in and they can do these and they can mark the moves. But just taking somebody out of something they love is usually not what you want to hear. You probably won't come back to see me, and I'm not helping you anyway. Um, so I feel like you have to know what that person wants and needs. If you have, I personally wouldn't, I would tell you not to wait much more than a week if you're having something that's not getting better yourself. So relative rest is different than rest. I don't mean do nothing. I definitely don't want you laying in bed all day. Um, but maybe you're not leaping, or maybe you wear sneakers instead of high heels for that class. And you mark a move, or you don't turn out as far. So I don't think you should do something that's painful. If it hurts every time you do this and you just do it over and over and over, don't do that. Which kills me because, like, my whole life, my dad was like, "It hurts when you do that. Don't do that." But there's actually, some meaning to that. So do everything else you can do, but don't do that one thing. Give it relative rest. Does it get better? Then okay, then jump in from where you are. And I don't think you need to see a medical provider. But if it's been almost a week, if things aren't getting better with relative rest, I would see a good PT. And like you said, that's hard. There's a lot of PTs out there, and there's a lot of great PTs out there. But there's a lot of PTs also that don't know how to treat a dancer, or um, don't understand what it is that we're looking for. So obviously, if you can find a PT that has a dance background, that's awesome, because they're going to understand a little bit more what's demanded on you. Now, at the same time, I treat athletes all the time that play sports that maybe I didn't. I'm a runner and I like soccer, but I didn't do lacrosse, which I'm in Maryland and everyone plays lacrosse. So I played around myself just to understand a little bit of what's demanded on them. And I asked them and I watched them. So it doesn't mean you can't have a great physical therapist without a dance background. You certainly could. There's also like I'm a manual physical therapist. That's what my residency and fellowship was in, and orthopedics. But there's actually performing arts residencies out there as well. I know we have one at Johns Hopkins. Um, so there's definitely people out there too that have gone even further in their education to understand dance injuries. So after that week, I would say I would find somebody that's either recommended by a friend that they really liked or someone that has some kind of dance background or interest, if possible. And that doesn't mean that you have to see them all the time, but we should work with you to like, okay, I want to see you twice a week right now, but just for a couple weeks to see what's going on. And then hopefully we'll get you back to what you need to be doing. I'm a fan of relative rest over just stop. If you're, and also like, how intense is that pain? Is it localized pain with a certain move versus like I'm having numbness and tingling down my leg? I'm having bowel bladder changes. If there's something that's a little bit more out of the ordinary, I would even come to see us sooner than that.
Well, and I want to kind of key into that as well because I'll speak from my own personal experience. I would say I have a background of like a 2 on the pain scale in my feet
Mhm.
that's constant. If I'm dancing, if I'm on my feet, if I'm teaching, it's there. It's not acute. I can't pinpoint it. It's not needles or stabbing pain. It's similar to day 2 if you did leg day or arm day. It's that you got a good workout in,
Yeah.
dullness that never goes away. But I have had days recently where I've called my mom saying, I'm at a 7 right now. Do
Yeah.
I need to go to the ICU? And she's like, all right, it's a 7. Talk me through it. Elevate your feet. Stay off them for 24 hours. Call me in the morning. And I call her and I'm like, okay, it's like a 5 now. And she's like, okay, elevate your feet, put some heat on it, stay off your feet, don't put on the heels. And, 48 hours later, it's a 3. And then it's down to a 2. And it's like, okay, you really overworked your feet in that moment. Maybe let's do some strengthening exercises to avoid it. So for you, when you hear something like that, or you're working with a client that's like, I kind of have this background static, but I'll have peaks and valleys. How important is it to act quickly on the peak, or do you wait for it to go back to the static and see if that static is elevated?
And I hear your story, like I would say, come see me now. And let's look at your foot. Let's see what's going on. Because if you get this from time to time, even if it's not a 7, even if it's a 2, I would still want to look at you and give you things that you could work on at home and see if that makes a difference in that. And maybe you won't get those 7 days. Um, for someone who is, and that's hard. I get it. Like I have a 3-year-old. I don't want to go to a doctor's appointment after I work all day and I'm away from her all day. I want to come home. I want to be with my kid. I don't want to go to PT. So I get it. And I want to get my workout in too. So it's how do we, I get it. But if you're able to, I would say it wouldn't be a bad thing to go get that looked at. If you're in that valley stage, that's a great time to go too. Many of us don't go at that time. Many of us wait for it to be bad. And then we seek help because that's when it hurts and that's when we're thinking about it all the time and having getting difficulty getting through our day. So I say a lot of people just do that naturally. But if you're someone who has a story like you, and they have like an underlying baseline weekly discomfort, that's the person I would say go see an ortho PT and see what you could do preventatively to prevent anything from spiking.
Awesome.
'Cause we certainly can. I mean, I have backaches, like I always have. It started when I was dancing in high school. Um, and honestly, if I'm active and I running is what I've gotten into in my later years here, but I feel like if I'm active, I feel pretty good and I know what I need to do exercise wise to prevent that from happening. probably once or twice a year, like I have a big uptick in my symptoms, and then I need a coworker to help with some hands-on care to get me back to my baseline. Other than that, I pretty much maintain it myself, doing the exercises I need to do. So I think it's a great idea to any of your dancers that have that ability to seek out somebody when they're in a little bit of a lull, can also help just to teach them some things to do on their own to hopefully prevent it from spiking.
Yeah. So the last question that I want to kind of end today on, and it might require a follow-up conversation if you're willing,
Sure.
is the the issue of experimentation in athletics. So obviously dance, specifically ballroom dance, we refer to it as dance sport. It is equal parts athletic endeavor and artistic expression.
Absolutely.
And as with anything that kind of falls into the athletic realm, there's a push to grow and further the sport, either by being faster or more graceful or leap higher or, spin more times or be more powerful, faster, longer, bigger, just push it to the nth degree. And with that comes coaches that have found success or have pushed their personal experience of athletics that then bring in students, either young in age or middle in age or older in age, and push them to further the next generation, possibly with or without medical oversight, possibly with or without long-term studies on potential side effects or issues down the road for doing things. So what can we do as students of the sport and teachers of the sport and leaders in the industry to make sure that we are cautious when experimenting with the next generation?
It's a great question. So I think with all sports, like you're saying, there is this need to like keep pushing and be better. I mean, to see what some of the dancers do today when I was that age, certainly different. They're amazing. And I don't think I looked like that when I was 6. Um, but that flexibility and how they're like forced into some of these positions. Um, I would like to see some long-term studies on that as well. I think there's definitely been some research out there that shows the importance of not just doing one sport, but that kids should be, I think it was like 3, like, but no more than a certain amount too. And I um can check myself on like what was actually said by, I think, like one of the sport associations. But it's the same idea with adults, like that ability to cross train. So if you're a swimmer, do you also have like a weight lift day, or do you go on walks and do some other kind of workout as well? Or if you're a runner, hopefully, if you run marathons and just run marathons all the time, that's the person that gets a lot of stress fractures and breakdowns and issues in other areas. So we know it is good to mix in different types of exercises and activities. So I think that's important that they're not just doing one thing and just constantly stretching or constantly working their muscle in the same way over and over, but that there's a difference in the way that the body has to work. I think it's okay to want to grow, and I think it's amazing what young people can do. And I mean, I guess people would say that about us too 20, 30 years ago, and how every generation just seems to do more. There's an importance in making sure, I think, that children understand that they need rest. Nutrition is huge. And luckily our PT program, and I believe other PT programs around the country, are really starting to incorporate more nutrition into our curriculum. And we are not licensed nutritionists, but having certain conversations about protein and eating enough to fuel your body, especially in a dance world. But eating disorders and disordered eating, I mean, we can have our own conversation and podcast conversation on that. um, is certainly a real issue with anybody at any age group in any sport. Not just ballerinas, but wrestlers and people that the weigh in, and just being, in today's society, we all have some of those social norms placed on us. But talking about nutrition with our young dancers, and then also making sure that they get breaks. Like, is there a winter break? Is there a spring break? It shouldn't be 7 days a week, but a lot of us do it 5 to 6 days a week. And making sure they're not having pain, that they're doing things right, that we're not forcing them into a turnout that they don't have, that we're not standing here pushing their leg further than it really should go into a hamstring stretch. Great, give a little stretch, but don't push it past what that muscle can actually stretch, where then you tear something or you hurt their joint. So I think it's really listening to them as individuals and pushing them to their ability, but not necessarily to whatever a max is for the most flexible person in the room. And that's hard. I think that's going to take us all a lot of time and attention, but that would be the best thing we could do for them, is really look at each one individually, push them to their physiological maxes, but not past that, because that's when they break down or they don't want to do it anymore or they start to have pain.
Yeah. And obviously, we have to pay special attention to kids because, bones and muscles are still growing and developing. And as individuals, they're still developing. So there's always a little bit of a power
Yeah.
differential in the room. But even as adults that are either continuing to do this or coming to ballroom dance later in life, what are those red flags for you where you would be the person in the room to say, stop, this has gone too far, this is not working for this person, or encourage someone to be their own advocate to say, time out, I'm not understanding what you're asking of me, or I don't think I can physically do this?
Yeah. And I think there's lots of signs. So I look a lot at body language and like facial grimacing and expressions, especially in children, but like you said, across the lifespan, because sometimes we don't say it. Um, but you can see in somebody's face that they're uncomfortable. So like maybe they are literally clenching their teeth, or they're making a face, or they're avoiding emotion. If I see that someone's kind of not putting as much weight down on that leg, or they're shortening a step that they don't usually do, or maybe they're not kicking as high, like that's my chance to say, just checking in, or like, you feeling okay? Is anything uncomfortable? So those are my big like red flags with something physical, but really like an avoidance, or you can just see like a mood change in kids for sure. And then, with kids, you kind of have that conversation, because it could be a bad day at school. It could be something with friends. I guess even with us adults, we all have our days too. So you can kind of, there's just like this avoidance of doing something physically that shows me that something doesn't feel right. I feel like over the years I can kind of identify early on if there's a problem with nutrition, and sometimes you can tell if somebody is frail, or I've had somebody tell me that they don't want to do a clamshell because they don't want their butt to look bigger. And I appreciated their honesty, but that tells me quite a lot about how much they're putting onto the way their body looks and what they're willing to do, or not to do, to make them feel better. So, I want to build that rapport with a person. I don't ever want to accuse somebody of an issue that's not there. And it doesn't even, I mean, there's kids today that like portion out egg whites and turkey bacon, and then they want to go lift at high school. And it's just like, even though they don't have an eating disorder, like that might be disordered eating for a high school student to think out how much protein that they are putting in their body so that they can build a certain amount of muscle. So there's always these things I'm looking for, and I don't always jump on it right away. But once I build this relationship with a patient, can I identify a need that I need to refer this patient to a nutritionist? And I might just start with somebody like that, or like, how are you doing with nutrition? Because your body does need food to heal from an injury and to be strong. And there's a physical demand that we're doing on each other. And even if we want, this thin, strong appearance, we need to fuel to be able to do that successfully. Um, so I try to always screen for that and identify when it's something that I can have a conversation with the person, or do I ask them, like, would you like to talk to a nutritionist about them? And being at the University of Maryland, Baltimore, it's really great because I have all these connections. So I can identify if somebody needs social work, or I can identify if somebody is in a domestic abusive situation, or somebody needs to talk to a nutritionist, and I have all these resources at my hands, and I'm very proud to work here for those reasons. But I think for you being in the studio, just looking for signs that somebody is physically avoiding something, that something hurts. And then if there's these other red flags that you're catching, that somebody might need to talk to somebody else in some other way, as far as, are they avoiding doing certain things? Are they not eating the way that they should be? And that's something you might not always be able to see in your role.
Yeah, and I
Or am I?
imagine that goes along with pushing through something, like pushing to do something, even though you're seeing all of those markers as well. So,
Yeah.
I'll have students that are like, no, I can do it, I can do it, I can do it. And yet they're gritting their teeth, or I can hear the joints squeak as they're trying to
Yeah.
lift their arm in a certain way. And I'm like, stop, please stop. Because I know that what you are doing right now is only going to make it worse. So I
Yes.
would rather us not. I know you want to get your perfect frame. I know you want to get your perfect form. I know we're working on contra body movement position, and you're feeling that stretch in your side. But let's take a break and let's walk away from this and say, okay, it's not a bad thing that you can only do this right now, because this is enough. I'm happy with this. Let's not continue to push it.
And that's awesome that you do that and identify that. And I hope that most dance teachers and coaches do that as well. And it's hard. I mean, even for us, but certainly when you're a young person, like, you don't think of the future. Like, you think of right then and there, and you want to be great, and you want to do this, and you want to do what your classmates are doing, and you want to please your teacher. But it's so hard to say, like, if you hurt yourself right now, you won't be able to do this in a week or in a year. So mark the move, or just don't kick as high, or like you said, take 5 minutes, just like walk for 5 minutes and stretch for a second, and then let's see if we can jump in, is a much better solution. So I mean, the biggest things are the nonverbal signs, like you said, but the facial grimacing and the avoidance, and that's a big sign of a fracture too. Like, if somebody won't put weight down, that's a big step to us. um if there's a clinical prediction rule that if somebody needs to get an x-ray for the foot or ankle, and it's discomfort in certain places, but one of the criteria is if they can't walk for 4 steps, like, immediately after an injury. That's a big sign that, like, all right, maybe you need to get that looked at. Stress fractures also don't always show up right away, so sometimes someone who gets a an x-ray right away after an injury happens and they say it's negative, if you are still having pain 2 or 3 weeks later, consider getting a repeat x-ray, because it can take 2 or 3 weeks for a stress fracture to show. Hopefully it won't. I am not a pusher of getting imaging done. Very much the opposite. But that something like a fracture is something that we don't want to miss.
Yeah, and that's
That's
really good
different.
to know too, that it could take several weeks for that to show up on an x-ray, because again, coworkers, students have said this hurts, gone in for an x-ray, it's come back clean, and have pushed themselves, and then a month later have been wondering, okay, well, it wasn't a fracture, why is it still hurting? So
Yeah.
that's very good to know that that is a possibility.
Yeah. If it's still point tender and hurts a lot 2 or 3 weeks after, I would consider getting it looked at again, because I see that, like you said, a lot.
Yeah.
People are like, oh, I went to urgent care, it's negative. But then a couple weeks later, it's just the process of the calcification. And with a stress fracture, it just sometimes doesn't show up for 2 to 3 weeks.
Yeah. The other thing that I would say is incredibly important for dance instructors, and I imagine incredibly important for PTs as well when you're doing an initial consult, is tell us the medical history that you are willing to share with us,
Yes.
even if you don't think it's pertinent. Like,
Yes.
even if you have full range of motion on your hip, if it was replaced 3 years ago, please tell me that you have a hip replacement.
Yes. I cannot force that enough. And sometimes I think people just don't even realize it, because it's their normal, like, they've been living with it. But I'll say, like, any medical history I should be aware of, any problems with blood pressure, anything like that, and they say no, and then I see in their chart they're on blood pressure medication. But to them, it's because it's they're on medication. So it's controlled. So they don't think that, but I need to know that because that blood pressure medication can blunt what I will see when I take your vitals. And I need to know that to know how to understand how you're responding to certain exercises. So yeah, people just don't realize sometimes it's not even on purpose that they didn't share with us surgeries or histories, or they had a hip dysplasia as a baby. Like maybe you don't think about that because it was so long ago. But if you had hip dysplasia as a baby and you're having some issues, or you're very hypermobile as a dancer, there's probably a correlation there. And that's really good for us to know, especially if you're having dislocations or issues like that. That tells me that your joint is pretty loose, and that's really important in how I'm going to do your exercises and manual techniques.
Yeah,
So,
absolutely.
yeah.
Awesome. Well, like I said, I feel like I barely scratched the surface on some of these case stories that I would love to get your opinion on. I know a lot of people are eager to hear more from you,
Yeah.
and just more understand their bodies better and understand injury prevention better. So
Yes.
maybe if you are willing, we can schedule a follow up and have you on for
Sure.
another episode.
Yeah, I would love to do that. This was fun.
Awesome. Well, thank you so much, Alisa, for chatting with me today as part of the podcast.
My pleasure. Thanks for having me.
Thank you once again to Alisa for being such an amazing guest. Like I said, we will hopefully have her on for a future episode of the podcast to talk about more of your injury stories, more common occurrences that she has with dancers, how we can better prevent some of our upper body and back injuries, and a whole bunch of other conversations. So if you would like to find out more about her, you can do so using the link in the description box below. As always, I'm Samantha. I'm your host with Love.Live.Dance. You can support the podcast by following Ballroom Chat on Instagram and Facebook. We also have a Patreon page. Differently than maybe past outros, what I would love if you have made it this far in the podcast, either on YouTube or everywhere podcasts are available, is to comment below either something that you are going to start doing in order to prevent injuries, or if you have something specific that you would like us to chat about the next time I have Alisa on the podcast, you can either send me a message or send Ballroom Chat a message through our Facebook and Instagram, and we will make sure to cover that topic next time we chat. So thank you once again for listening. I hope you have a wonderful rest of your day. Stay safe, stay positive, and I hope to see you dancing very soon.